In Scientific American, there is an incredible article. It's really one of the most outrageous conversations that's happened over the past 2 years. The World Health Organization urges vaccinated people to wear a mask, and the CDC still says, no, there's no need to. The World Health Organization leaders advise caution as there's new variants that threaten all the progress made with this pandemic. And let me tell you, if there's one conversation that is absolutely ridiculous, it's this one right here. So let's dive in. But before we do, I'm Dr. Nick Zarowski, and welcome to the channel. Be sure to subscribe, hit that notification bell. And also, I want to tell you, because I'm excited about this, we just opened up our one-on-one health consulting program. We only do open enrollment a couple times a year. And this is a program where we help you improve your health naturally. We use science-based data like lab data. We determine the deficits within your body, and then we make a plan of action in order to help you not only reverse the health concerns that you're facing, but also avoid future afflictions, disease, and also promote longevity. And we do this all naturally, so it's truly incredible. We see amazing transformations within this program. If you're interested in taking control of your health naturally, go ahead and click on the link below, and you can schedule a free wellness advisor appointment and see if this program is right for you. Now let's talk about this very fun conversation. I love this conversation because there hasn't been a more dishonest conversation over the past couple years, and I think it really has been going on too. Now, the World Health Organization is urging people to continue wearing a mask and social distancing, even if they're fully vaccinated against COVID, because, we were all told that if you got vaccinated that, you're going to be protected, but yet we find out that there's nothing that can protect you from the boogie monster, right? There's literally nothing you can do. What was the point of getting it if it doesn't actually protect you? Now, amid the spread of a concerning new variant and high levels of community transmission in many places, while most COVID vaccines are thought to largely protect against all known variants, none is 100% effective. You know what? Listen. There's nothing that's 100% effective when it comes to anything, right? I mean, has the flu been around forever? Is there anything that's 100% effective against the flu? No. Is there anything that's 100% effective from avoiding ear infections, avoiding cancer, avoiding heart disease? The answer is no. So the idea that there's going to be some 100% effective anything against anything is absolutely an outrageous conversation. And so these dishonest conversations that keep happening are nothing more than hilarious if you have truly done your due diligence to know what is actually going on out there. Because we have this idea that, well, we have to protect ourselves because we think that we could just live forever if somehow we hide in a closet or hide under our mattress forever. It was really sad because 2 weeks ago, we were at a 4th of July parade. And as everybody was walking towards this parade, I mean, everybody's walking down the side of the road and a lot of people were heading that direction. And there was a mom and a young child, and they were both wearing masks. And I looked at it and I just thought to myself, how sad is that? Because obviously it's ridiculous to be wearing a mask outside. There's no one even remotely close to you and you're wearing a mask. And I thought about the psychology behind that because, I always say that, part of my job is just being a psychologist, like literally understanding people, understanding their thoughts, understanding what I have to do in order to make them make change in their own life. And I thought, wow, what a horrible psychology that these people must have. I mean, when you literally are so afraid of your environment that you're willing to wear a mask out in the middle of nowhere when there isn't really anybody around you, and you're outside? Like, how crazy is that? When you literally think the world around you, the air that you breathe, is going to kill you. I mean, how can you do anything in life? How can you be positive? How can you be grateful? How can you make positive change? You can't, because you're terrified of your own environment. And so this is something, unfortunately, most people have been just literally scared to no end. And they're making decisions like this, like driving around all by themselves in a car with a mask on. Like, it's unbelievable. The WHO also advises vaccinated people to keep taking precautions such as staying in a well-ventilated area and avoiding crowds. This still continues to be extremely important even if you are vaccinated. When you have a community transmission ongoing, said Samoa, the World Health Organization Assistant Director General of of access to medicines and health products. Well, that's quite the title in a recent news briefing. What we're saying is once you've been fully vaccinated, continue to play it safe because you could end up as part of the transmission chain, added Bruce. As of this writing, the U.S. Center for Disease Control and Prevention has not changed its latest stance. It says that people do not need to wear a mask in most indoor and outdoor settings, apart from places that require one, such as hospitals, nursing home, jails, and public transportation. When asked about the WHO's advice for vaccinated people by the New York Times, a CDC spokesman referred to its existing guidance and gave no indication those recommendations would be altered. The agency had not yet responded at the time of the publication to a request for further comment. Here's the thing, is like I feel like we don't even really know like the World Health Organization, like who are they sticking up for? Because I don't think that I don't believe for a second that they actually care about the general population's well-being. So you can put in the comments, who do you think that the World Health Organization really cares about or cares for? Are they caring about some countries over others? Are they literally just promoting nonsense? I mean, here we have the CDC, and then we have the World Health Organization. We have them not agreeing on this topic. We have social media, which literally will basically censor anything based on the World Health Organization's recommendations. Like, we're in the United States. Like, why isn't social media paying close attention to what the CDC has? Instead, they pay attention to the World Health Organization, which does not make up laws and rules here in the United States. It's the most bizarre thing in the world. And then to top it all off, you got guys like Anthony Fauci saying there's no need to wear a mask. Like, he said that in his emails. And then he flip-flopped because he just makes up things as he goes, and most people don't realize this. He's just a politician in a white coat. He is not a doctor that is all-knowing and knows more than every other existing doctor on the planet, like many people think he does. But, you know, you have him saying in his emails that they don't work, and then you have him going and telling everybody to wear one mask and then two masks. I mean, it's the most bizarre, and at the end of the day, what it really comes down to is these people don't even know. They're just making stuff up off a whim. They're like, yeah, wear 3 masks, you know, like, sure, why not? I mean, heck, if you got an extra one laying around, throw on 4. The CDC guidance that vaccinated people do not need to wear a mask or socially distance is in most situations was issued in mid-May, before the highly transmissible Delta variant was widely circulating in the US. That variant, which was first identified in India, is thought to be 40 to 60% more contagious than the previously dominant Alpha variant, and it poses a risk to unvaccinated and partially vaccinated people. Breakthrough infections in fully vaccinated people can occur, though they are rare and usually less severe. The CDC guidance for unvaccinated people continues to be that they should wear a mask in public indoor settings and follow other public health precautions such as distancing and keeping to well-ventilated spaces. Okay, so I think at this point, everybody's over it. Everybody's done playing the games. They're done with these organizations just making stuff up as they go. And at the end of the day, I'm going to tell you right now, it doesn't matter if it's the Delta variant, if it's the Beta variant, whatever variant it is, it literally doesn't matter. The one thing we know, and this is the same thing that I've basically educated on since I actually went and studied up on COVID and literally learned what it was about and what worked and what didn't work and who was dying from it. And I broke it all down throughout the whole COVID process. And the one thing that we know that matters the absolute most is that you have to be a healthy individual. The most important thing is your baseline health. If you have a comorbidity, if you're obese, you have high blood pressure, you have high cholesterol, you have high blood sugar, you have any of these different problems, pre-existing conditions, those are what you need to focus on, okay? 6 masks, that's not going to do you any good, okay? The other thing is that you really have to focus on boosting your immune system. Many people have very depressed immune systems today because they're very unhealthy. And so I've been promoting, there's a immune kit that I've been promoting to people. It's called Immune Basics. It has like your basic level immune supports in it. Your vitamin D, your vitamin C. It's got some N-acetylcysteine, which has been proven to be wildly important for fighting COVID. So, I mean, it literally just has the bare bones necessity immune essentials in it, and so that's also good, and it's cheap too. It's like $40. It's like $39.97 or something like that, and it's like a whole month's worth of like all these great immune boosters. I'll put a link to the one that I use in the description. But here's the deal. Like, you have to worry about your health, okay? These conversations about masks and these conversations about different variants, they're ignorant. They are totally ignorant at this point, okay? And these politicians are, jumping into all this nonsense for political gain. They're jumping into this nonsense because they're trying to take control. Many companies, many major companies out there that are very wealthy got extremely wealthy through COVID. So what do you think that they're going to promote? They're going to promote more lockdowns, and it hurts the average person. I mean, that's why there's the largest transfer of wealth has happened over the last couple years, simply because there's so many people getting poor, and all the rich people that are all pro-lockdown, pro-mask, pro-everything, they are getting wildly wealthy during this whole thing. So, I mean, everybody is responsible for their own health. You're responsible for taking action in your own life. I recommend that you take action on your health and you focus on getting yourself healthy. And like I said, I mean, if you're somebody who's suffering from these conditions, you need support, we literally have a one-on-one health consulting program that we just opened up, and I'll have a link to that in the description below as well. But there's so many things, there's so many options out there for you. You have to take control, because you can't sit home scared. It is ridiculous, and honestly, it's unhealthy in so many ways. So take action with your health today, and I'll see you in the next video.